So yes, thank you for having me along. My name's Jill Quinn and I am the founder and the CEO of a charity called Dementia Forward. And we now cover the whole of North Yorkshire and the city of York. And I'm going to just touch on what dementia is and talk a little bit about what we do. And while I was sitting waiting, I was sort of wondering, you know, where this fits. And I can see clearly where this fits because I witness every day the struggles of families dealing with dementia. And obviously, where there are children involved, they play a huge part. So I clearly can see where the gap is and where the fit is, and perhaps why you invited me as one of the reasons anyway. Okay, and then but what I'm going to do is I'm not going to talk for too long because I think the questions will probably be the best bit. So we'll see where we get to. One of the reasons that we are constantly bombarded at the moment with information about dementia, you know, we're busy talking about the Care Act at the moment. You've heard Boris trying to work out how he's going to find the money to care for people. And one of the reasons, one of the good reasons is that we're living longer. But unfortunately, the highest risk factor for getting dementia is age. It's not the only risk factor, that's important to note, but it is the highest risk factor. And so we are facing a crisis ahead if we don't address what's going on with dementia. And this is the way I see it. Does anybody remember the fatberg that they discovered? I think the first one was discovered in London. And it was the size of something like 6 double-decker buses, weighed tons. Now, the way we think of this is, I can't help thinking that somebody knew that was down there, okay? And you sort of visualise that group of workmen one Friday night lifting the lid off to see what the problem was and thinking, I'm not going down there. I don't like the look of that, and putting the lid back on it. And I think we continually ignored what was going on under the ground. That is what I feel we've done with dementia. And now it's here. It's not something that's coming. It's already here. And we've left it a little bit too late. So we really do need to respond. One of the best ways we can respond is like this, talking about it and trying to normalize it. It's a medical condition, like a lot of other medical conditions, but it still has fear attached and stigma. And mainly that's because of our ignorance around it. So talking about it is a really good thing to do. Okay, so this is just to try and demonstrate the kind of numbers. So the incidence of dementia in the population who are under the age of 65 when they're diagnosed, and we support people in their 40s and 50s, but the incidence is roughly speaking 1 in 1,000 people. That is underestimated, if anything, but about 1 in 1,000. Now, important to know, dementia is not a natural part of aging. So we're not all going to get dementia as we get old. It is a medical condition. But unfortunately, as I've already said, there is a risk as we get older. So when you look at that picture there, the 70 to 80 age bracket, we've shifted right up to 1 in 50 people. That would be quite remarkable if you walked out onto the streets right now and lined people up. It's a lot of people. But then over 80, it's 1 in 5. And then over 90, it's more like 1 in 3. And over 100, we don't really know. And we are living longer and longer. So babies being born today actually have a 30% chance now of living to be 100, which should be celebrated. But it means that we are constantly shifting that number higher and higher of people likely to get dementia. So what I will say is this is not a them and us thing. This is an us thing, because it is unlikely we will go through our whole lives without being affected by this condition, either ourselves, our partners, our friends, our neighbours. Very unlikely that all of us, any of us, will be untouched by dementia. This is how we explain dementia. A common question that I get asked is what's the difference between dementia and Alzheimer's? And actually Alzheimer's disease is a form of dementia. So dementia is the umbrella term, but Alzheimer's is the most common type. And then second to that, I won't go through all of them because there's over 100 types of dementia, but we hear about vascular dementia. We have, was it Julie on the line, whose mother had frontotemporal lobe dementia. There's many types of dementia. Parkinson's disease can have a dementia attached to it, etc. We set our stall out, though, to just support anybody who has dementia in our charity. And most people have similar presentations. When it's important to know the diagnosis is when you are really up close with somebody, because each dementia does have slightly different traits. So some people will suffer more with their balance and their spatial awareness, and maybe their memory is not too bad in the early stages. It is a progressive illness. That's what I meant when I said this is not an entertaining speak. It is a progressive illness, and there is no cure. So what we need to do is try and normalise it, try and accept that it is here, and then crack on with supporting people to live well while they can with the diagnosis, and to be there for people through the progression, and in particular to support carers to do the function that they're going to carry out, supporting their loved ones. So I'm going to talk now about what we do, but I'm really happy at the end to answer any questions, technical questions about the illness. I just thought I'd move on to what we do. And what we do has expanded so much, I realised, even during lockdown, that it hardly fits on a slide now. So I'm going to have to rethink how I do this, because we're changing all the time. But I think one of our best functions is that we have a local helpline. And you can ring that number any weekday, and it is answered by trained staff. And we're able to connect people up, take referrals, signpost them to places they need to know about, give advice, and give emotional support. Hopefully, when people ring us, we can turn that into a referral, because then we can allocate them their own support advisor. And that person is their support advisor right the way through the illness. And most people only need arm's length support for a while, and it's only when things start to change or something goes slightly wrong that they might feel they need to reconnect with us. But what we do is we ring anybody we haven't seen. We do home visits, we do lots of activities, but anyone we haven't seen, we would aim to ring them between 3 and 6 months. It's drifting at the moment because we're so busy. The idea being we don't wait for the crisis. We check in with people, how's it all going? We listen to what they've got to say, and if they need us back again, then we'll go back out again. So we have a team of support advisors. We have a dementia specialist nurse, which helps to guide us. All our helpline staff and our dementia support advisors really get the support of that nurse, as do families. We have a new thing of dementia care coordinators. We have 6 of them across the county, and those people are working in GP surgeries primarily, and they're looking out for the people who fall between the cracks, because too many people are struggling and not getting a diagnosis. And whilst it's not a nice thing to get a diagnosis, it does open doors, hopefully, and it does mean that the family begin to understand the condition. We provide education, support, but we can't do that if we don't know where they are. So we have dementia care coordinators currently supporting people to get a diagnosis, and we support the families through that process. We have a very special young onset service that we've just managed to grow, because it's very different when you get dementia and you are working age and you've got family, you've got a mortgage, and also you're probably physically more active and less inclined to engage with some of the services that are out there for people with dementia. So we have an outward bound young onset service, and today actually people have travelled from Ripon to come to York to have a day out, and that gives the carers a day's respite. And we're managing to do that now across more than half of North Yorkshire. We run hub clubs, and this is our way of renaming daycare. I have a bit of a thing, it's only me probably, well, I don't think it is only me. Daycare conjures up a vision in my head of a circle of armed wing chairs, winged armchairs, where people are sedentary and maybe a game of bingo, and it just, for me, it just doesn't cut it, because each of those people sat in those chairs will be as different as we are sitting in this room, and we don't all like the same things. So our day services, we've changed the name to Hub Clubs. Club implying that it's a membership thing, that you're in it together, you meet the same friends when you come along. And we range our activities from table tennis through to knitting, arts and crafts. It doesn't matter really. We get to know the person and we try and match the activities. But meanwhile, while we're doing that, the carer is having a day's respite. We've successfully managed to, we've extended from one of those hub clubs before lockdown to now opening 4, and we have a 5th on the horizon. The nearest one to here will be opening soon. It's not very near, it's in Pocklington, but we would do our best to provide transport for anyone who needed to use that service. So that's our hub clubs. And then in 15 different places across North Yorkshire, every single week, we rent somewhere and we open a pop-up cafe, and people can spend the afternoon with us doing similar activities to what I spoke about, while the carer can get advice and information. And wherever we go, there is tea and cake in copious amounts. So that's how we tick. I just want to mention well-being. It gets talked about an awful lot. And I think most of us go through life not realizing that we are looking after our well-being, because we know how to do that for ourselves. So for myself, if I'm feeling grumpy, or I'll just go with grumpy. If I'm feeling grumpy, wide open spaces work for me. So it's a walk. I need to get out, get some fresh air. I know that because I'm well. A person with dementia doesn't necessarily recognise what it is they need to do to keep their well-being topped up, and they rely on family and friends and people around them to do that. And we work a lot on how are we going to keep this person's well-being topped up. And if I just quickly run through this flower, Kitwood wrote a lot about dementia, very wise man. And he said, for any human being to have well-being, they need all these things that are on this petal. Central to it is love, and there are many types of love, but feeling loved is quite a human thing to want for most people. But to achieve well-being, we need attachment. So we like feeling, most of us, that we are attached to something or somebody. It could be a cat, it could be a friendly neighbour, but we feel attached to something or somebody. But we have comfort, and comfort, it's not just the comfy chair, it's that we know how to operate the central heating, that we have food and water, that we feel safe. Feeling safe is a biggie. So that's our comfort. That we have identity, that people know who we are. They don't just know our name, they know a bit about us, they know how we tick, and that creates our sort of connections. That we have meaningful occupation. So I'm back to the winged armchairs. There is nothing meaningful about sitting in a circle looking at each other after a while. Might be all right for 5 minutes. So a meaningful occupation, and that is about us doing something that feels worthwhile, gives you a good feeling. Inclusion. And inclusion is a funny one, because we could be sitting in this group and not feel included if we didn't get the warm welcome that you so did provide when we all arrived here today. It could be that we've spoken a little bit about people who are hard of hearing. That can really exclude people if we don't work out how to get around that. So we need to make sure that people feel included. We do that for ourselves. Somebody with dementia needs our help to do that. And the best way we can do that is keeping people attached to their communities, giving carers the support they need to keep all these things intact. Because if one of your petals falls off, you begin to feel wonky. 2 fall off, you begin to start getting poorly. 3 fall off, and we really are now needing a visit to the GP. And I think a lot of the time, when we're out visiting, when we're seeing somebody in a care home where the care is suddenly going wrong, if we sat down and drew the flower of that person, we might find the root cause of what's going wrong. And after all, there is no proper science around dementia, so we rely on little things like this. Okay, before I finish, I've always loved this. Have you seen that before? It's dead cute. And I am going to admit that I was guilty of thinking we were getting everything right because we did give equality. We did make sure everybody got the same service. But there's such a difference between that and equity. So we all need something a little bit different. And I hope that we do tailor our services to the individual. We don't get a mass of people with dementia in one room and think we know what to do for every one of those people without looking at the individuals. And when you hear Neil speak, I'm just going to say before he comes on that until fairly recently, I thought we were doing a really good job of LGBT work as well. We'd supported Neil, we'd done a good job of that. So where were we going wrong? Where we were going wrong was we weren't proactively reaching out and we weren't advertising the fact that our service was there for everybody. And Neil has now become a trustee and I think we're on the right track now. So yeah, every day's a school day.
Thank you, Jill. Nice to see you all. Thank you for coming. Yes, my name is Neil, and as Jill quite rightly said, I'm now a trustee of Dementia Forward. I have a longish talk, which I normally do, but I won't do that today. I'll just pick pieces out of it. But I am a member of the LGBT community. My late partner died 6 years ago now, having lived with dementia, most probably for the best part of 10 years before he passed away. And it was very difficult for him because he had come from a very difficult background. And I know this isn't something that I'm not really too much bothered about, but I think he was. He'd come from a very working class background. He was 9 years older than me. So during his younger days, he was born in 1935, he was then classed as a criminal because the law of the land was such that homosexuality was banned until 1967. So he was in his 30s when the law changed, but it didn't change that much. All it did was to allow consenting adults in private over the age of 21. Private meant in a house, which was one of the consenting adults' private residence. Hotels were not allowed, guest houses were not allowed, and if you were in rented accommodation, you were not allowed to be participating in sexual activity with a same-sex partner. That didn't alter for many, many years. So although the 1967 Act did change things, it didn't change it that much. So therefore, in his younger days, he really struggled with his sexuality and his lifestyle. And when we got together in 1974, and things had only improved in 7 years, and they haven't improved that much, it was still very difficult for us. He was not really out as people are these days, and he struggled quite a bit. The first 15 years were fine, we got on really well, but then after that, he had a very bad nervous breakdown, and it transpired that he hadn't been totally truthful from the very beginning. He'd hidden all sorts of things, and after that, our relationship deteriorated a bit, but the last 10 years of his life were really difficult. He really struggled with his mental capacity, with his loss of his memory, and it put him back to a really scary time, to a time when he was still classed as a criminal, really, because he'd lost his short-term memory, he'd gone back a long way, and he really struggled with it. He was very possessive, he was very jealous, he was very scared about people breaking in. We had to fit locks on wardrobes, for example, because he thought while we were out, people were coming in and taking his raft into his clothes. We had an intruder alarm fitted to the house because he felt that people were breaking in while we were out. And the intruder alarm had an auto dialer on it, so it rang our mobile phones if anybody did attempt to get in. And so, yes, times were really, really difficult. The other thing, of course, as Jill mentioned, and as our group is, we were aging without children, so there was no support. And we had even less support because John didn't want to feel part of the community in any case. So that made life even more difficult. And I know we now live out in the country, and our lifestyle is not that easily accepted in a country environment. It's not too bad in towns and cities, there's usually, in larger towns and cities, there's usually a gay village, so your identity can be lost into that, which is really helpful. But of course, we didn't have that support. Jill's organisation, we got in contact with once John had his memory assessment, which was really, really useful. And the Admiral nurse visited about once a month, once every 6 weeks. But that was our only real contact. So it was really, really difficult. So for people aging without children, and especially the LGBT community, it's really a bit of a double-edged sword, because you're struggling with your sexuality, especially for your older people like ourselves, and you're struggling with the fact that you've got little or no support. So it is a very, very difficult time. Fortunately, these days, and if people are able, you can find all sorts of useful guides, organisations, Dementia Forward, and if you've got the ability to get on YouTube, you can watch and share other people's lives in the same circumstances, which is it's really quite helpful these days, and it does make you feel as though the world has moved on a lot, and especially in the last 20 years, to be a lot more accepting and make life a lot more easy for us. Yes, it's been a really, really difficult time, and it's something which I share, and if we had more time, I'd do the total talk and go all the way through it. But that's the sort of bare bones of it. I now am a member of, well, I'm a trustee of York LGBT Forum, along with Sue. So we do various talks and LGBT awareness things through the forum. I'm now, as Jill quite rightly said, the trustee of Dementia Forward, but I'm also their LGBT lead and estates manager. I have the longest title, which I've put on paperwork. So yes, but I'm also working with a chap called Claudio De Lorito, who's a research psychologist at Nottingham University. And he's trying to pull together, and we're hoping getting funding this month, to do a support document for all healthcare organisations to understand some of the needs and difficulties that the LGBT community face when starting to learn to live with dementia, and sometimes the other problems that it creates. We don't want to keep it too totally LGBT exclusive. We want to learn from other people that have experienced a dementia journey, because I think it's quite useful to understand that as well. But we do find in a number of cases where LGBT people do not get the best healthcare, or do not get any healthcare, and don't get very understanding healthcare. So that's the whole idea of this. It's called Rainbow Paths, and it's a thing that we're trying to create. And hopefully, as I say, we'll get funding this month. I've done work with the LGBT Foundation in Manchester on a programme called Bring Dementia Out, which again was geared towards the LGBT community. I've done work with Home Instead. As you know, I now work with Dementia Forward. And Jill and I really we didn't come to blows, but we sort of realised that we had a common ground when they did a very nice document a few years back, which explained that Dementia Forward recognised that dementia affected everybody, whether they were rich or old, young or rich or poor, young or old, black or white, and that's what started our association.
Yeah.
Yeah.
Yeah. So I wrote. What did I write?
So it says on the front,
I'm so proud of it.
dementia has no prejudice. It affects everybody, rich or poor, young or old, black or white. And yes, we've since changed that. We now have the rainbow flag included, and we've done lots of other diversity things. It's going to be a long, ongoing process, but it's really greatly improved, and it's much more inclusive. Yeah. So that's where we are these days.
Shall I take?
So yes, that's me. Thank you. Seats all yours.
First of all, I'm just going to admit Diane, who's got bumped out. And also to say, when I move my thing here, to say that we do opening the closet door on dementia, which Anne and I do a paper bag person, and Anne comes out with a paper bag, a brown paper bag, and her two little eyes and a little mouth. And it says, "I'm 80 years old. When will it be safe to come out?" And she tells the woman's story from a woman's point of view, from a lesbian point of view. So that's interesting. We do that as well. And then Neil follows on telling his story about his partner, gay partner. So you've got opening the closet door with both sides of the story there. And also Anne and I did in 2013 a show called Dementia and Me, and that is an hour-long presentation show, actually, so because it was the Real People Theatre, and we have 3 scenes, starting with the diagnosis of dementia, then going on to not being able to even recognize your own daughter, and then finally in the care home. And we get the audience participation, and it is a very moving show. And we've done that in care homes and for care organisations and workers throughout Yorkshire and further afield, London and all over the place. So anyway, that's called Dementia and Me. So we think that dementia is a very important part of people's lives, and we need to talk about it more. So there you go. Phone us if you want to know more.